My Lords, extreme heat does pose a serious risk to NHS buildings and services, and all NHS organisations are required to have effective arrangements in place for adverse weather. We are supporting trusts to target the most critical estates risks with £6.75 billion over 9 years, including risks that need to be dealt with in respect of cooling and ventilation, and we are ensuring that new hospitals and new build neighbourhood health centres have climate resilience embedded in their design from the outset.
I welcome the answer from the Noble Baroness, but last Wednesday was London Ambulance Service's busiest ever day for life-threatening emergencies. At least 6 NHS trusts declared critical incidents. 9 in 10, my lords, of our NHS buildings are ill-equipped to handle heat. The Climate Change Committee's well-adapted report argues urgently for solar, batteries and cooling across all public buildings. Yet Great British Energy's programme covers only 200 out of 1,200 NHS sites. So will the Noble Baroness, the Minister, commit to ensuring every hospital has solar, battery storage and air source heat pumps by 2035?
The Government is indeed, and I've mentioned just some of it, providing substantial investment to trusts on these measures, and that's very much in line with the Government's net zero ambitions and intent. So we are investing £155 million in solar projects, £400 million in heat decarbonisation grants across the NHS. And I would emphasise the point that looking forward that all NHS new builds and major upgrades will align with the net zero building standard.
My Lord.
Okay, my Lords. I'm grateful. Following from the Noble Russell's question, before we have all the solar systems in place, could I urge the Minister to have an audit of major hospital trusts for their backup power systems, in particularly to ensure the refrigeration facilities are available and on a continuity basis, both for the storage of medicines, life support systems and all the other essential parts which require electricity?
Yes, indeed. And going back to my point about the £6.75 billion estate safety fund, that the whole intention of that is to target the most serious risks like the Noble Lady refers to. So vital projects will attract that funding. That will include overheating risks such as broken chillers, outdated air handling units, and other needs such as, if needed, refrigeration. In other words, where there is a need for urgent upgrades.
My Lords, last night, here in the House, the Parliamentary and Scientific Committee, of which I am President, held a meeting on the effects of extreme heat on the workplace. And during the course of that meeting, reference was made to the fact that in the recent heat wave last week, several MRI machines failed. Can I ask my noble friend whether she might invite the Physiological Society, who've done a great deal of work on the effects of on human bodies of heat, should be consulted about possible ways in which in the future these types of event can be avoided?
It's an important point that my noble friend raises, and it is important to notice that extreme heat particularly affects the buildings that have poor insulation and limited natural ventilation, and of course have a heavy reliance, I am therefore describing many health settings, where there is heat generating equipment, so imaging suites, IT systems and so on. So by its very nature, and I would also say we are dealing with an estate where 11% of NHS buildings are older than the NHS itself. I think it gives some scale. To the point my noble friend raises, we have committed £10.5 million in research funding to develop effective cooling solutions that can be used across the whole of the system, and it may well be that the organisation to which he refers is part of that. But I will make his suggestion back to the department.
I am grateful to Noble Lady the Minister for answering Earl Russell's question on new build hospitals, but clearly there's a question about existing hospitals, existing facilities. I just wonder what plan there is, or what strategy, or if it's written down or not, has there been to identify those hospitals that do critical and time-sensitive procedures to make sure they are prioritised for when there are extreme heat conditions, and also perhaps to commission independent hospitals which have the appropriate cooling and ventilation systems to allow those critical operations to go ahead.
Well, we are already investing some £30 billion of capital across the NHS estate. I've mentioned the most serious infrastructure risks, which the Noble Lord rightly refers to. As I say, whilst we accept that the age of the estate and also the size of the estate, we're talking about the equivalent of 4,000 football pitches, I noted in preparing for this point, is that we also have backlog maintenance issues which have just grown and grown and grown. Some 15.9 billion we estimate now is needed. And I would say, whilst there's no easy solutions, what we do have is a plan of resilience, not just in terms of overheating, but all threats to resilience through temperature. And we are also providing the funding, although it's down to local decision making, to the point the Noble Lord makes, but we are ensuring that we are assisting the estate across the country to meet the challenges that it has, with a priority on those areas that need it most.
My Lord.
Aside from the estate, patients on medications known to cause issues in extreme heat are not always being given the specific advice on adjusting these during extreme weather, and as a result have been admitted to hospital. So what work is the department doing, particularly given we have further hot weather coming, to ensure patients receive the right advice and support to avoid hospital admissions as a result of such hot weather?
The current recent heat health alert that we saw was actually the first alert since July 2022, and certainly the UK Health Security Agency has updated, first of all, its weather health alerting system, and that's important in order there can be preparation and action put in place, but it also has expanded its guidance, its communications, and also training of staff across the health and social care sector so they can better deal with the challenges.
My Lords. Oh, sorry.
My Lords, I was very pleased to hear the Noble Baroness, the Minister, say in response to the Noble Earl Russell's question that all the new hospitals and hospital projects that are in the pipeline will be climate-proofed, including resistance to extreme heat. But I would like to ask about care homes. The most vulnerable in society include the elderly, a category to which I admit I belong, along with a number of other noble lords, and therefore care homes are an important element of protection against extreme heat. So could the Noble Baroness, the Minister, tell us what plans the government has to ensure that care homes are as well protected from extreme heat as she said hospitals will be in the future?
Well, clearly it's a different situation, not in terms of climate, but in terms of the estate, because I know the Noble Lord's aware of this, but it's worth pointing out that, of course, the social care sector is rather more fragmented, including through the private sector. But certainly what is the case in terms of social care is the availability of advice, what measures to put in place, and also training.
My Lords. Many workers across many sectors are suffering
unbearable temperatures that they're expected to work in, and that's increasing demands on the NHS and its services. So does my noble friend the Minister agree with the principle that health and safety laws can drive adaptation in workplaces that are necessary for the health and safety of the workforce, as has happened with the introduction of a minimum working temperature? Is it time that we had a maximum working temperature, as the TUC have called for?
I acknowledge very much the push my noble friend is making. The decision she asked me to comment on, she will understand, is not one for my department, but I will certainly draw it to the attention of the appropriate ministerial colleague.